I'm Gary Wheeler. I'm a 69-year-old male. Grew up in Michigan, came out to California some 30 years ago, and serve as the Chief Executive Officer of a not-for-profit organization that really takes care of primarily older folks. So we do retirement communities, skilled nursing, assisted living, about 26 affordable housing communities that serve a wide array of populations, from the chronically mentally ill to seniors to low-income families. So it's a pretty active work life, one that I enjoy and one that kind of demands my time in ways that I don't have control over it. Now for fun, one of my major activities is swimming. I enjoy swimming. I love pets. I got a good dog. So those are the kinds of things I do. Gardening's a good release for me, but much of it centers on my work. Well, I probably had glaucoma longer than when I was diagnosed. I got diagnosed probably around 2010, but before that I had been doing regular appointments with an optometrist, going in annually for exams, and was always told my pressures were good. I was doing the field of vision test and always told everything was normal, and then all of a sudden had one experience of going to the same optometrist and told that actually my field of vision was contracting and that my eye pressures weren't bad, but something was going on. So on one of my visits, I found out that my field of vision was contracting, and evidently I had increased elevated pressures, but I had never been told that. So I mentioned it to my family doctor, who knew Dr. Richardson very well, and said, "This is a person I want you to see." So I came in, and not only were the scores a little high, they were really high. And so we began having conversation. And I'm not a person who's good with drops. So the way I live, it's just an incredible inconvenience to try to stay on a regimen of drops. So I talked to him about skipping the drops and listening on the phone on hold one time. There was kind of a commercial on the phone line about canaloplasty, and I asked Dr. Richardson about that and asked if I could go right to that rather than going through the whole drop regimen. Got approval from my insurance company, got approval from him, and we went right into surgery in 2011. So it's been a good 4 years now. Instant improvement. I did the one eye in March and did the other eye in December of that same year. It almost sounds unreal, but one of the highlights for me of the whole process was coming to the office, meeting Dr. Richardson, working with the staff. I remember saying at one point when everything was all done, I was kind of sorry that I'd run out of eyes to do the surgeries on, because it was such a fantastic experience. I mean, it was like walking into a family setting, but with a great sense of competency and a lot of assurances. I'm also a person who doesn't like general anesthetic, so I was really pleased to have a procedure where it was just not a general anesthetic. I found the procedure absolutely fascinating. Recovery was quick. Surgery on a Friday morning, stayed home that afternoon, pretty much normal activities on a weekend, back to work Monday morning, no complications. Some inconvenience because I had that drop regimen for a while before the surgery and afterwards, but since then absolutely nothing. My vision's been good. The pressure scores have stayed low now for 4 years, and I can swim. You know, some surgeries wouldn't allow me to do that, but this one clearly does. And so it's just been a marvelous experience for me. I mean, I highly recommend it to everybody in my office who talks about having glaucoma or discovers they have glaucoma. So I'm just one of those people who really feels fortunate both to have finally caught it since it was being missed, and then I feel very, very fortunate to have this surgery available at the time when I ended up having the glaucoma, and then finding Dr. Richardson and his staff. It's just been terrific. I'd have done anything to avoid a drop regimen. Still would. 4 years later, no drops. That's exactly right. Still well under control. No further decrease in vision or field of vision that is held. So from that perspective, I'm a success story and a very happy customer.